Today, I really am happy to be here, and I'm delighted to see so many familiar faces. And basically, I was invited to the Ministry of Health to work with the coordination of long-term care provision. And what happened, the pandemic hit us, and we had this opportunity to work with COVID-19 pandemic. And I was invited to work especially in COVID-19 executive committee. And before I start, I would like just to give you a brief picture of Lithuania and existing healthcare system. And basically what we have is 60 municipalities. And comparing to the other countries, we do not have a network of hospices, but we have a network of nursing homes, where in each single municipality, people have access to palliative care bed. What that means that in every single nursing home, there is established a certain number of palliative care beds, and it gives an opportunity and access to the locals to have their treatment or receive palliative care in the local area. Lithuania is not a huge country. It's 2.7 million size, 2.7 million inhabitants, and the size of the country is close to Belgium. So today I'm just going to briefly talk what happened during the first pandemic wave and how we managed to overcome the upcoming challenges and continue providing palliative care in nursing homes. So I think the success and key to success was an early response to the pandemic, right? So 26th of February, we declared a state of emergency in our country. And what that meant is that all the healthcare institutions had to prepare for upcoming pandemic. They need to count how many staff they have, how many healthcare professionals would be able to work during the pandemic, how many protective gear and equipment we had in our warehouse. 28th of February, we had a first positive COVID-19 case in Lithuania. And it was a lady who was skiing in northern part of Italy and came back to Lithuania. 11th of March, just 2 weeks after we have declared state of emergency, WHO declared a global pandemic. Just 5 days after that, Lithuania has announced a countrywide quarantine. And what that meant, that all nursing homes were closed for visitors. And that meant that palliative care patient wouldn't receive any visitors anymore. And for those who are coming to nursing homes as a patient, they had to stay in quarantine for at least 2 weeks. So basically what we did, we saw that it is really hard to manage every single municipality and to approach every single healthcare institution. Therefore, we decided to have a regional approach, and we established 5 huge regions in Lithuania, where we selected one healthcare institution that was responsible in providing the information to the Ministry of Health and feeding the information for the network of the hospitals in that region, hospitals or other healthcare institution. It allowed us to allocate our staff, healthcare professional, if there was a breakout in one healthcare institution, so we could eliminate those professionals working there and bring healthcare professionals from other institutions. It also allowed us to distribute personal protective equipment and create a green corridors for inter and intra-hospital patient transfer. I think one of the greatest challenges what we had, it was that nursing homes, they were not equipped with oxygen beds and they didn't have any artificial ventilation. So basically what we did, we established over 500 beds with oxygen flow, and it helped us to give the treatment to palliative care patients and other nursing home patients treatment they needed. So here I would like to briefly review the chain system that we were able to establish. So we selected the manufacturers during the first pandemic with those manufacturers who could provide us protective equipment and gear, and we used local and European funds to purchase it. So we basically had 30-day supply in the main warehouse, and from the main warehouse, all the equipment and gear were distributed to 5 regions. And each single healthcare institutions, they had supply for 60 days. And in the main warehouse, we had supplies for 30 days. And what that meant that we were safe for 3 upcoming months. We also noticed that providing protective gear and establishing oxygen beds is not enough. There were many breakouts in nursing homes, and the people living there are very vulnerable. So therefore, we decided to establish educational platform for healthcare professionals, just to go step by step and remind all working staff what are the symptoms of COVID, how to wear a protective mask, what to do if the patient who is in the institution gets a COVID, and how to act, who to call. So basically we launched online sessions, and we approached all regional hospitals and nursing homes. And I think the success factor was that we were able to reach about 90% of health professionals working in nursing home. It took a lot of time calling each single municipality and approaching each single nursing home, but the effect and impact was huge. So a few months after quarantine was announced, there was a quarantine release. And during the quarantine, it created a lot of stigma and burdens in our society, because family members, they were not able to visit their loved ones living in nursing homes, and many people left this world without having a chance to say goodbye to their family members. So one of the first thing that Ministry of Health were able to establish was to allow family members to visit the patient once in a day, no longer for than 15 minutes, wearing protective gear. And it was a huge relief for our society, and especially for those who had relatives who were living with life-threatening disease. So here I would like to briefly talk about the factors that affected our decision-making. So first of all, we looked at international recommendations provided by WHO and European Union. We also looked at local experiences, because there were few nursing homes who had not a single COVID-19 case. And we looked what they did, how they organized the work, and we were talking and disseminating information about their best practices. We also were trying to understand the residents. What were their expectancies, religion, behavior, traditions, and culture, just to have a better approach while disseminating the information. In addition, we look back retrospectively to SARS and MERS, just to understand how it affected nursing homes and nursing facilities during the previous pandemics. In addition to that, so we did an analysis of global countermeasures, and we were looking for best practice models that we could adapt in Lithuania. And in conclusion, I'd like to note a few things. I think the best thing, well, when you decide to approaching healthcare professionals, is to know your audience, to know what are their expectancies, to know what they stand for, to know the work culture. And if you have this knowledge, it's easier to project and easier to give and bring the message they're looking for, or the message you would like to send. using personal approach, calling each single nursing home and talking with each single healthcare professional gives a support feeling for those people working in healthcare institution. And that builds a trust, builds a trust for the people working there, and they know they can count on the Ministry of Health, on the politicians, and our decisions makers. And I think the most important thing is to send the right message, to be clear, to say the truth, and believe in what you say and believe in your goals. I'm looking forward for your questions.